Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Clinical presentation. Patients with pelvic junction obstruction, the infants are mostly asymptomatic. Most of the times they are asymptomatic, so it is actually incidentally discovered either by a prenatal ultrasonography or there can be palpable abdominal mass may be seen sometimes. It is only seen sometimes. Then, once you suspect pelvic junction obstruction, then you will have to diagnose the case. The diagnosis is done by ultrasonography. In ultrasonography, you will see that there is hydronephrosis can be seen on ultrasonography, but ultrasound does not diagnose the disease. Actual obstruction, where the obstruction is and what is obstructive cannot be diagnosed by ultrasonography. It diagnoses that there is hydronephrosis. To know the actual site of obstruction, we can do intravenous pyelogram. Intravenous pyelogram is done to define the pelvic junction obstruction. But nowadays we have a better test which is diethyl triamine pentaacetic acid can be done DTPA scan. So with the help of this DTPA scan, we can detect the pelvic junction obstruction. Thus the DTPA scan is the investigation of choice for pelvic junction obstruction, and it will establish the reason for hydronephrosis. It will establish that hydronephrosis is mainly due to the obstruction, and where the obstruction is can be determined by DTPA scanning. Then we can also do pressure flow studies. Then we can also do pressure flow studies or through Whittaker test. So these pressure flow studies and Whittaker test are not generally done nowadays because it is an invasive test. So because it is an invasive test, it is only used in cases or conditions where where you see equivocal result on the renal scan, where you cannot diagnose actual disease in the renal scan. Then we can use this pressure flow studies or Whittaker studies. This pressure flow study will measure the differential pressure between the kidney and the bladder. So if this is the kidney, the pressure difference between the kidney and the bladder, this is measured by the pressure flow studies or Whittaker studies. So how do you do this Whittaker test? Here first you will make a percutaneous puncture is put on the kidney. First you will puncture the kidney and then you will infuse the contrast fluid through this puncture at a constant rate, and then slowly you will monitor the intrapelvic pressure. Now if you monitor the intrapelvic pressure, on monitoring the intrapelvic pressure, if there is abnormal raise of pressure flow studies are seen, abnormal raise of intrapelvic pressure is seen, this will confirm that there is an obstruction is present. So this is Whittaker test which is done. Then we can also do retrograde pyelogram. Now if you do a retrograde pyelogram, this retrograde pyelogram will give us the proper idea about the anatomical aspect. So this will show where the distal end of the obstruction is, can be shown by retrograde pyelogram.
thank you and thank you for watching.